These organizations have figured out that if you walk up to this ATM and you hit it 3 times on the left side, money comes out. It's not their money, it's lots of money, and they've gotten used to having an infinite supply of money.
Is part of their benefit then, what you're indicating, that state employees, for example, are at a zero risk level with the HMO, is that part of the payoff?
This could easily be part of the payoff. Only an outside independent audit would determine that, but that is exactly a possibility. We've already stipulated that we were subsidizing the GAMC program, which is not permissible. Who knows what else we're subsidizing? And this report says, according to the HMO bookkeeping, you can't determine what's being subsidized. As taxpayers, how can you allow public business to be done with vendors who don't keep adequate enough books to determine where your money went? Who would do business with companies like that, even on a personal level?
I hate to keep asking questions, sir, but you referenced HMOs quite a bit. What about the private hospitals? They're non-profit. Emmanuel St. Joseph here in this town, for example, Connected with Mayo, others.
Well, here's the deal. I worked for the State Hospital Association for almost 30 years. Large hospital systems are currently making deals with these HMOs. The so-called accountable care organizations are partnerships or collaborations, if you will, between large systems and these insurance companies. The fuel that runs these business enterprises is likely this money. Because remember, most of the healthcare marketplace, probably 75%, is government programs and ERISA employers. And what government programs and ERISA employers have in common is they hold their own risk. They don't buy insurance, they hire people to manage their money. And that's exactly what's going on here. The HMOs, the insurers, are no longer in the insurance business. They're in the claims processing money management business. And that's a different business. There are people who will argue to you that you can buy people who will do that for 3 or 4%, not 25%.
Now, you're referencing insurance companies, which we folks think of as free enterprise.
Absolutely. And I don't mean, that's why I typically say HMOs. My comments do not reflect anything on property casualty, life insurance,
Right.
or other indemnity carriers. Their world has nothing to do with this for the simple reason they don't have access to a broken federal cash machine.
Right.
Okay? You've got to be involved in the Medicaid program to do this. And that pretty much limits it to
So then are you
HMOs.
saying private insurance companies are also part of this game?
No.
Scheme? I'm talking one that provide health insurance,
Here's the problem.
Blue Cross Blue Shield.
Blue Cross Blue Shield is one of the 4 HMOs. Okay? The 4 HMOs are Blue Cross Blue Shield, Medica, Health Partners, and UCare.
Okay.
They have well over 90% of the market. The other thing you have to understand is that in Minnesota, if you're a fan of free market competition, we require HMOs to be nonprofit by statute. We don't allow for-profit HMOs in this state.
Right.
How would you have competition if you require that only the 4 nonprofit, what I like to call HMO pay? You know, this is a cartel. This is a group of 4 nonprofit organizations that have a lock on this market. They are operating an oligopoly, a cartel. They continue to operate it, and everything they do is in partnership with the government in what appears to be one of the most anti-competitive, competitive hostile environments one could imagine.
All right, so when you reference waste, sir, are you talking primarily then about overpaid salaries for those that are administering the program, managing the money essentially? Is that what you're
Actually,
saying?
no, I won't even go there. We don't know where the money goes. I do not begrudge a CEO several $1 million a year.
I would.
You know, this is, this is America. If your shareholders think you're worth that kind of money, God bless you. My problem with these companies is there are no shareholders.
Correct.
Okay? And so a lot of these salaries and a lot of these compensation and bonus arrangements are set internally. And there's a question as to where is the oversight. And therein lies a different problem. When I talk about accountability, these people are taking money, they're putting it in reserve accounts, which are now into billions of dollars. When the reserve accounts get too heavy, you can invest in the stock market because reserves are only counted as cash. can't count equity securities as reserves, not under their rules. They operate their own parallel universe accounting system. And so, from the people who brought you credit default swaps at AIG comes this accounting system, this NAIC accounting system. And this is what is running this enterprise. And these organizations have developed a scheme. We now know how it works. We know what they're doing. And by the way, we know what they're doing because one of the state employees said what they're doing. I don't want you to get a mistaken impression that, you know, I've figured out this imponderable thing. Somebody said this aloud, and I happened to hear it. Okay, this is the extent of my brilliance in this transaction. Okay, I heard it and I understood what it meant. You know, I took those statements and I went to the people I work for and I said, here's what I heard. This is what they said. This is illegal. A couple of weeks later, there was some more exchanges. And I explained to my then employer that this violates a number of federal laws. Something must be done. And they did. They fired me. So at least you have to give them points for decisiveness. But now it falls to all of us as taxpayers to deal with the issue of, are we going to tolerate this? Are you going to give them a pass on this? 2 weeks ago, I was in Washington, D.C. with our Commissioner of Human Services. I was answering questions about this issue, and she was answering questions about a number of things, including a series of emails, because you see this, UCare last year gave back the state of Minnesota $30 million. Now, and I want you to stop and think about something just for a second. UCare is a nonprofit, 501c3 charitable HMO. Their mission is to provide health care to people. They've got $30 million to throw around. Why aren't they throwing it around on health care? Why aren't some senior citizens having their Medicare Advantage premiums lowered? Why aren't they out in some supermarket parking lots doing health screening for people? Why aren't they looking for kids in school who lack some sort of immunization or treatment? There's a million things they could do other than tip the state of Minnesota with $30 million, what appears to be taxpayer money. Having said that, this transaction in the last 12 months has been called the repayment, a refund of an overpayment, a charitable donation, or an administrative expense. It cannot be all three. And there seems to be some debate about which one it was. Now, I'm a lawyer. And to use a little lawyer jargon, I would always look to the donor's intent. Now, UCare, who gave the money back, said it's the refund of an overpayment. The state said it's a donation, a charitable contribution. There's also a string of emails saying, well, here's what UCare said, redraft it, make it say this. These are problematic approaches to the issue of accountability and transparency in government. If you've got people doing this, you've got a problem. The other thing I will tell you is that if you want to think of our public programs as a grocery store, what we've been doing in this state is we go after kids shoplifting candy near the cash register, and we hunt them down and kill them. These are medical providers who get caught up in mistakes. In the meantime, people are backing up semi-trailers to the back of the store and cleaning it out. We don't care. That's crazy. So something has to be done. This legislature has kicked the ball forward because there's an election coming. Everybody's for audits. It's just that they don't really want to do one. Last year in Minnesota, we said the word audit. UCare gave back $30 million, and the other HMOs, Dayton wanted them to give back some more money. They wouldn't do it. So they agreed on an administrative cap, which is an amount they can manipulate by, because there's no definition of what constitutes administrative expense, cap on profits. We recovered a total of $103 million in the state because we said the word audit. What would we get if we did an audit? You know, and that becomes the issue. At the end of the day, that's the issue.
So let me just mention my own personal interest in this, and we've got questions for Paul and Connie. As you know, politically, I'm committed to balancing the federal budget in 6 years or less. And that means that for 2013, we have to cut spending by something like $200 million to be on schedule. Well, what we're talking about here is apparently something like half of that. And so if we can recover $100 million without cutting programs and without raising taxes, you have to go for it aggressively. And that's one of the reasons I'm so appreciative of the work that David Feinlock is doing. And one of the reasons that I have a unique interest in this, apart from being a taxpayer and apart from being a citizen of Minnesota. Paul, go ahead.
So as we walk out the door, what can we do collectively, we the people, to help support the efforts that you're setting forth?
The first and most important thing you can do is you can call or write your state legislator, both representative and senator, and nail them down and say, I don't like the fact that you just passed an audit bill that doesn't start for 3 years. Why did you do that? And did you support that? And number two, what are you going to do about all the years going back that this money is vaporized? How are we going to get this money back? It's tax money. You're entitled to a share. If everybody obsesses, and this is the point I believe you should make to them, you know, we all focus here on making sure that the governor and the legislature doesn't raise the Minnesota tax another penny. I agree with that. But we're allowing federal tax rates to fluctuate as they are, and we're squandering the money. And this is not chump change. This is huge and significant money. This is deficit reduction money. This is real dough. So what you have to do is you have to tell them that this is important to you, because I assure you what they care about is the Viking Stadium, okay, and where liquor can be sold, and whether or not there's going to be gambling other than in Indian casinos. These are the kinds of things they care about. This stuff is hard stuff. This involves insurance and math and big numbers, and it's icky stuff. Nobody really wants to look at it. You know, plus, these HMOs that we're talking about, they provide a lot of money to a lot of fine organizations. They give away a lot of money in charitable contributions. It's your money, mind you, okay? You didn't get to write it off on your income tax. It's your money, but they're giving it away. And all these people who receive that money, they have no interest in having that money get shut off. None whatsoever.
Seems to me that would be a job for Lori Swanson.
I would agree. I would agree.
Would be a heck of an undertaking.
Well, it would certainly be memorable. But the point is, at this juncture, Mr. Quist has read to you a congressional staff report. Okay, it's not a comic book. It's not an opinion page out of a newspaper. It's a report. The United States Congress, congressional staff, that says Minnesota is a stunning example of lack of oversight and fraud. These documents say the same thing. How big does this pile have to get before something happens? Every major financial crisis in this country has only been addressed as we crawl out from under the wreckage, whether it be real estate, the banks, Wall Street, just for a change. Wouldn't it be nice to intervene before it collapsed?